Hi everyone, Walt Lewis with Disaster Medical Solutions, and today we're going to talk about assessing a patient from a remote location. Not maybe too far away from them, but just where you can't get genuinely hands-on to their contact. So we're at the Florida State Fire College in this beautiful area of Central Florida, and we're working on the pile there, simulating a victim is trapped inside of a building that's collapsed from a gas explosion or other man-made or natural disaster. So here we are at the disaster, and we're trying to find those patients. So there's a rhythm for us to find S.L.A.M. First we want to search, locate, assess, and monitor. And we can do this on the grand scheme of things when we're looking for lots of people. We always want to be able to find where the victims are so we know what we need to do. That's the whole premise of our SUSAR teams, is to find the victims and be able to remove them. But we don't want to just grab them and pull them right out. We want to make sure that they're treated appropriately and removed safely so that all the work is done effectively for the patient and not in vain. So in this case here, we have a gas explosion or simulation thereof. The building has collapsed, and we've got bystanders that are able to give us intelligence on what has occurred. So utilities may be secured, and we want to make sure it's safe, so we've got those first responders handling that. And as we make our access, we're searching for that victim. Bystanders were able to pass on to us. Maybe they were in the building or know of victims that were in the building, or there's an accountability list of that victim or group of victims that we're looking for. And for this, we've got somebody that's calling out. So the search method that we can employ now, it's a very low-tech method, is called a hail search. We can utilize untrained rescuers or would-be rescuers to assist in this operation, and somebody that's going to coordinate the effort circulates the pile, calling out, listening for any noises from the victim. Something that's not so rhythmic that would stand out if it's banging, but in this case here we will hear some screaming from the pile. Now, to do that basic hail search, we circulate around the pile, and I can have several other untrained rescuers pre-positioned in locations so that when they hear something, they simply extend their arm pointing at the direction of where that sound is coming from, and the idea to triangulate in best service of finding that sound. Now, of course, the larger the pile or the more challenging the building, the more difficult it's going to be to genuinely do that. But you do your very best. You employ the best tactics for the given situation. So having those bystanders, we'll imagine they're pre-positioned around the pile. I will circulate around and use very simple commands. You don't want to use very elaborate terms like task force or search team rescuers. Just something basic. Everybody understands fire department, so it's a common term to use. So we'd yell out, "Fire department, anybody in there? Make noise!" And try to keep your communication slow and deliberate so that the words don't jumble together. People in the pile will more likely hear you better than you hear them. And the longer you communicate, the less likely you're going to hear their response. But if they hear you, they will probably make noise regardless of a language barrier or how entrapped they are. The drawback to this mechanism is that the patient has to be conscious to be able to respond. And even conscious patients may not be able to verbally respond because of when the collapse occurred. Concrete, dust, and other material may have blocked their airway sufficiently to prevent them from being able to call out loudly. And then if their hands are trapped and they aren't able to clear their airway, they can have a hard time getting their voice heard. So as we circulate the pile, we're listening, and as we move forward, we walk around the pile, calling out, "Fire department, anybody in there? Make noise!" And then if we hear that noise, then we can give further commands, maybe something more specific where we have them bang 3 times. So this way we know it's a positive response to that communication. If it's something deliberate, we don't want it, we may try to listen for Morse code, but very few people seem to know the genuine SOS and Morse code these days. Some noise we want to investigate. Now, what can also get us to this point right now are other assets, like our Canine search assets, who would search the pile and smell for victims, and they do an incredible job of isolating all the other smells, and only that one smell they can't find of that victim that's trapped that they're trained for, do they alert on. And it's a fantastic resource, but they may not be on this deployment, or they may be at other locations. So this, again, is another low-tech mechanism. Something else we can employ are search cameras and also listening devices that are very sensitive and pick up sound from inside the pile or hard surfaces and enable that transmission of sound through the material to become the sound we hear with our ears. So it's seismic transmission of sound to the auditory, to our ears, with the certain devices that are out there. But back to the search cameras, there's several companies that exist. There's Zistos, Savox, Leader, and for today we're going to use Agility Corp's FL360. So the First Look 360. And it's a rescue kit that we use for assessing the patient. So we're going to specifically use that one. We'll get access to the pile, and of course when you're getting close to the pile and with your other responders, you want to make sure they're properly protected. Here I've got my helmet, I've got a headlamp on, gloves, this way I can encounter any concrete debris, be less likely to tear up my hands. Underneath I would have patient care gloves, so just understand that I would have those there as well. I don't today. Knee pads for my knees, and it's an optional, but you bang your knees enough, you'll wish you had them. Steel-toed boots, and comfortable as that. If they're not very comfortable, they're going to be tough to navigate in, so you want to make sure that they're going to be your important footwear foundation when you're navigating loose rubble. So with that, you could also have elbow pads and maybe a BDU jacket, and it's certainly weather dependent and any other protection you may need. Eye protection also is going to be something very important for being on the pile. But you may have to remove it, so just be very cautious on where you encounter your hazards. And of course, for the pile going in, utility core in the area has shut off gas, and there's no sensor readings of any of those hazards. Electricity is also turned on. So with our bystanders that may be giving us help, we want to make sure that they're in a safe position to do the same. Well-trained rescuers or well-intended rescuers, we want them to both be safe and not hinder the operation, but to help magnify our capabilities. So we approach the pile, we're sizing up where we think we may find victims, and we're looking at void spaces that identify where a victim could survive. So at this point, we're working to locate the victim. So again, search, locate, assess, and monitor. We're working to locate the victim. We've had our bystanders help us point in the direction where we hear the sound, and now we're going to make access to where we believe that victim may be entrapped inside that void space. We've got our search camera with us, and we can start putting it in places to find those voids that might house a victim. So using our sound, leading us to the location. In this case here, we've got a simple prop set up. And we may have breaches that are already in the concrete that are very beneficial to us. We could use a coring drill, or we could do a dirty breach where we break the concrete apart and not worry about what's on the other side. In this case here, we've got an opening that exists, and we're going to use it to our advantage. If we end up breaking through the concrete, we talked about a dirty breach, we may want to do a clean breach first to make sure that we don't drop any components on the victim who's already suffered a calamity. Now we can hear the victim inside. So I insert my camera and start sizing up the situation. Now, in putting the camera in, I've got a positive ID on a victim. And I look around and I see I've got a victim here. And I just set the camera up where I need it to be based on whatever length. Now, I've got a lot of options available to me using technology. Now, if the victim can hear me, they can respond to my commands, and I can ask them to give me their name, medical history, if they know what happened to them. I can do all my assessments that I need to do as a standard care provider for any victim of any other calamity. Now, with this given camera, I can also set it down in location, leave it in place, and help monitor the patient for long term. I can set my range and my depth as to where the camera needs to be. And one of my favorite options of this particular camera is being able to move it around to how I need to view the void space. So it's not giving me the true view that I want, so I just make my adjustments. And there's my victim. And it looks like beyond them, I've got another victim in the background. One that they were not able to answer for themselves, but because I found the one making noise, that helps me find the second one. So it's not uncommon to find one victim near another victim. And I realize that with the color of the skin tone, and I'm going to treat it like a savable victim until I can determine otherwise. Now this is where I begin my assessment. I start looking at my victim and checking for any signs of life, of breathing. I look for eye movement. There's everything in the face that I want to see. And of course, I'm calling to them, asking for them to respond. We hear them giving coherent noises. He's coughing, so that's a good sign that he's got an open respiratory tract. But something is irritating that respiratory tract, so we want to be able to help provide them care. The opening's big enough, I can give them a vessel to pass them some safety equipment if they're able to take care of themselves. Something like a water bottle cut open with eyeglasses or eyewear, some hearing protection, a dust mask, all the things that I would want to protect them with and be able to take care of them remotely with. Maybe even pass them a bottle of water so they can be in rehydration, clear out their airway, wash out their eyes. But also don't forget, if there was an explosion, eardrums may be compromised, and with the communication being challenged, they may not be able to hear you as well, or may be very muffled. So slow, deliberate communications is very important. We can see in the picture that this victim, or I want to call him a patient. In the USAR world, frequently called to his victims, but I like patient in the sense that he's still alive and we're able to take care of them. I can assess them and I can see, looks like maybe some CSF fluid coming from the ears. I can see their eyes. They don't have, they've got a lot of dirt in their tear ducts, and they've got a lot of open nose solution. So there's a lot of coagulation around their nose. So he's breathing. I can see the dust moving. So those are all good signs, even if he wasn't able to verbally respond to me or my commands. So with that, I'd like to be able to assess his injuries. And if I had to, I could pass the camera further down his body. But in this case here, this camera doesn't bend and travel down the body. There may be another style of camera I want to employ. So having more than one tool in our capable toolbox will make us more efficient, more effective. So, other things we want to look for in something very similar or something very simple is cap refill. If the patient were unconscious, we could also maybe push against the patient, look for that blanching of the skin, and then quickly draw back the camera and see if that color change occurs. If we see that color change in the unconscious patient that doesn't respond to pain, but the blanching of skin occurs, then we would probably have good cap refill, or at least delayed cap refill, to indicate circulation is occurring. So these are all indicators we want to try to employ to find and assess that victim from the location we're at. Now, ultimately, if we have this victim alone, then that's the only one we have to worry about. But this is a pretty large building. Figuring as big as it is, we may have other victims that we have to go take care of. So it's not unreasonable that we may leave this camera here, set in position, just so we can monitor the patient while we are assessing another patient nearby if we discover them. Now, as a medical specialist, I'm looking to take care of as many patients as possible, but I want to be able to focus that care to every patient that needs my determined care, my determined capabilities, as the rest of the team is operating to find those other victims and assess them as well. So this is a skill I can certainly pass on to my other team members so they can assist and magnify my capabilities. In checking out this first patient that's been responsive, I can also work over towards the other patient and see if they have any kind of signs of life. By being able to zoom in or being able to turn and get a better perspective, I can get an orientation on how the victim lays and be able to communicate that with the rescue manager so that the breaches and rescue work being done are done effectively and properly. So this way we don't accidentally drop concrete on the victim or compromise the victim's ability to get out faster. We want to make sure we go the right way the first time. So we've assessed the patient and now we're monitoring. We've got the camera set in place, but it's a little difficult to see the screen. And as I try to get away from the sun, the shadow cast is a little tough. I'm trying to cover it with my body. It comes with a shroud to go around the screen, but one of my favorite techniques is using a BDU jacket, draping it over my head, and then I'm able to utilize the screen a little better. So by having it mounted on my chest, it allows that shadowing a little better. But in this case here, I've just got it handheld so that we can see it for the value of this video. But here I'm able to assess the patient. I can also look for other injuries. I also look for any blood that may be showing, anything else that I didn't see. So continually positioning the camera and monitoring the patient as I go. I want to be able to fully assess the patient as best as possible. But being able to cover up allows me to be able to see as good as possible for that patient's benefit. Just one other trick that's out there for you to be able to employ. Some of the points we've covered were searching, locating, assessing, and monitoring for patients inside the rubble pile. Disaster medicine is not an easy tactic to employ, so we got to use a lot of our talents and pull from ideas that we may not always use in the regular world. But the tools and equipment, the capabilities, and our peers help us do better. And here at the Fire Academy, we're able to practice some of these skills. So with that SLAM method of search, location, assessment, and monitoring, we're able to use remote items to assess our patients, talk to them from the other side of the wall, use cameras, just anything else we can employ to assess that patient until we can get our hands on them and effect the rescue is all our purpose. So, till next time, take care.